Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Friday, November 6th, 2020. So it's been a rough week for new cases worldwide and here in the United States. Across the world, we saw 3.6 million additional COVID-19 cases, which is about 150,000 more than we saw last week. Here in the United States, we saw record totals with 675,000 new cases, which is over 100,000 more than we saw the week before. Here in Massachusetts, we're reaching some new heights, getting really close to the levels we were at the beginning of the pandemic, seeing 9.6 thousand cases in the last week, which was about 1,300 new cases over the week before. We should probably expect that next week we will cross 50 million cases worldwide and 10 million here in the United States. In terms of deaths, things are also starting to tick up there, both worldwide and nationally, with 50,000 deaths in the last week, about 5,000 more than the week before, and just under 10,000 nationwide, which is about 3,000 more than it was the week before. Here in Massachusetts, 134 people died in the last week from COVID-19. So let's take a look at these numbers in a more visual way. Looking at the counts across the country here, we reached a record high of testing yesterday, but also a record high of cases, and hospitalizations are also on the rise there, and we're getting very close to our earlier highs. And you can also see we have started to see that slight upticks in deaths as well. So right now everything's trending up and many things are the highest they've ever been. Looking across the country here, you can see this is new cases by state for yesterday. Now, these are just one snapshot day, but that is a snapshot on the day of the most cases ever. So you can kind of see how bad it has gotten across the country here. Now, this is new cases in raw numbers. It's not just for population. So a state that is larger like Florida or Texas having higher numbers, that's affecting a smaller percent of the population than, for example, states like the Dakotas, which are seeing fewer new cases than us per day, but have so few people in them that they're seeing really massive numbers of cases relative to their size. On the right side of the chart, you can see how many states are getting any specific tier of cases, with 5 states getting over 5,000 new cases per day and 32 states having over 1,000 cases a day. Looking at this one more way, sometimes I've shown the chart of when the record highest date of new cases was in any given state. They've changed up the chart a little bit to also show what that record was. So you can not only see how bad it was there, but also when it was the worst and also how bad it was there. This is also adjusted for population here. So it's otherwise something like, Vermont, which is a small number of cases, but also a small number of people, be barely visible at the bottom there. But you can look along here and see the various surges there, with New York peaking in April, and then things coming down again, with higher cases being the highest case being a lower number. Now we are kind of an outlier there because we had a lot of backlog cases released that day, and a lot of places just have not been able to pin those to date. So we still show as our highest date being at the end of May, when it was actually in mid-April. But then you can see as well the surge in the summer that affected the South and West. And now you can see our current one, which is pretty much all the Midwest there, reaching highs there, and some of them reaching the highest highs ever, such as North Dakota up there at the very top right, which is the most cases ever by population. And that's in the last week. Because these are not just the highs, these are just for population and for a specific day. not like over time. This is one-day cases when they really hit the tops. But it's not just the Midwest peaking now. We also have a lot more places in the West that are having second or even third peaks, and some places in the Northeast are starting to see some more as well. Like Connecticut, for example, is tucked in there, having a new peak after being part of the initial spring wave then. So cases are one thing, but hospitalizations are where some of the real stuff happens. We saw two massive peaks. Hospitalizations tend to follow cases by about 2 weeks, and then deaths follow hospitalizations in a similar thing. Now, fortunately, deaths are probably not going to be as bad as they've been earlier, and we'll talk about that in the next slide, but you can see where we're at for hospitalizations, where we were just below 60,000 cases in both earlier surges. We never crossed that line, but now we're on track to do that within the next week or so, maybe, if things continue on this trend, which they're likely to do so, because even if the case counts were to start magically dropping tomorrow for new cases, hospitalizations lag behind that, so they still have that kind of inertia that's going to keep pushing this up, even if the case numbers start to come down. So we are right here, very close to our highest points ever, and we'll possibly pass those soon. Now, mentioned deaths as well. This is where deaths are happening and trending up. As you can see, it's the Midwest is where a lot of that is happening right now. It has not yet passed its earlier spike from the first part of the year, but does seem to be on track to do that shortly. The South has also plateaued in terms of deaths. We're dropping off from the summer surge, and they're now holding pretty steadily. And the West and Northeast are trending upwards, but very slightly. But fortunately, the advances we've made in treatments, in just understanding how the disease works, deaths are likely to not get back up to those early levels unless there's just a massive breakdown of the hospital system, which may happen in some areas if the hospitals are just overwhelmed with new cases to the point there just aren't resources to take care of people. So moving on to developments. First of all, we had our first day of over 100,000 cases, and then the next day we had even more. We had in about 107,000 cases on Wednesday, and yesterday we had 116 to 120,000, depending on which numbers you look at, but much more there. So the two highest days of the pandemic history, and often Fridays or Saturdays have the most reporting on them. So we may be on track to pass that again today or even tomorrow as well. So that is where that stands, unfortunately. This is the highest part, and I don't want to call it the peak because I don't know if it will peak soon. It's still the potential that case counts can still keep rising. Also, there has been some stories recently about the virus spreading in mink. A lot of mink farms, both in Europe and America, have been forced to kill their mink population due to COVID spreading through them. There's some concern with that perhaps the virus could mutate in the mink and be something slightly different. Most scientists don't have a lot of concern that this would happen enough to make a vaccine less effective, but the ability of the virus to jump back into mink could serve as a potential reservoir. If we were able to eliminate it in humans, the virus could flee into mink and then come back into humans later. So that's just one other thing going on. But in better news from the Mustelidae family, since mink and other weasel-like animals are able to get COVID-19, we've been doing a lot of testing in ferrets, and a nasal spray is developed that appears to prevent COVID infection. It doesn't treat it, it doesn't mitigate it, it's actually a preventative. Spray it in the nostrils of ferrets and then put the ferrets in a cage with some infected ferrets, some ferrets who received a placebo spray, and 24 hours later, the ones who got the spray were not infected, all the ones who got the placebo were. Of course, they give the ferrets a placebo, so the ferrets won't know if they got the real treatment or not and contaminate the results. So this is really hopeful if it could work on humans. We don't know exactly how well it'll translate, but the idea is just you could spray it in your nostrils and then go out and just not get COVID. Of course, there are other issues there besides the general transfer from one animal to another. Humans breathe through our mouths a lot more than many other animals, so I'm not sure how it would work for preventing infection that way, or maybe this would just be the perfect thing for all those people who wear their masks under their nose and just only covering their mouths. All right, so for our sources for the stats and trends here, you can find them at the COVID Tracking Project for all the graphs, New York Times for the basic numbers, and mass.gov for the information from Massachusetts. And for more for the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.